The weapons used to fight tuberculosis are now completely outdated. There are 3 diagnostic tools, but they're old and don't work very well. The skin test, the chest x-ray, and sputum culture, which tests mucus from the lungs. All 3 have their flaws. They're slow, complicated, and unreliable. There's some good news though. Since 2011, there's been a new diagnostic test. It gives a result in 2 hours and detects both TB and resistance to a main anti-TB drug. A doctor's dream would be a fast and reliable test using a drop of blood or urine in order to start treatment immediately to stop further spread of the disease and to save the patient. And talking about treatment, we've been using the same drugs for the past 50 years. Even in uncomplicated cases, the treatment regimen is long and hard to follow, taking 4 antibiotics, rifampicin, isoniazid, pyrazinamide, and ethambutol, every day for 6 to 9 months. The treatment regimen for resistant cases is even more complex. 2 years of treatment, a cocktail of pills and injections, and a number of grueling side effects for the patient. And in the end, only 1 out of 2 patients is cured. For the doctor, convincing patients not to give up mid-treatment is a daily challenge. Despite all this, there's some good news on the horizon. There are 2 new anti-TB drugs in clinical trials, bedequiline and delamanid. It will be several years before they're accessible to everyone. However, in some countries, and in a very small number of cases, doctors can already prescribe bedequiline to patients in whom all other treatments have failed. And to round up, the vaccine. BCG, which has been used since World War II, prevents the most serious forms of TB in children, but it does not prevent transmission. An effective vaccine for children and adults is still a long way off. Researchers are not giving up, but there's nothing to note down in your agenda until 2020 at the earliest.